Hello and welcome back to our next topic of discussion, which is planning for the future. We have Michelle Hearns, licensed social worker, and Dr. Walter, who will be talking to you, giving you more information on this. All right, Michelle, you can take it from here.
Good afternoon, everyone. Can you hear me okay in the back? Yes? Okay, good. Put this down a little bit. There we go. My name is Michelle Hearns. I'm with the Medina County Office for Older Adults, and I'm with the Adult Protective Services Division of that office. I'm the supervisor. But I've been with the county and with that office for 26 years. And over time, I've learned a lot. I continue to learn a lot. There isn't a day that goes by that I don't learn something about a new resource, about a client's life and their story, or about myself. And that's real humbling when you learn something about yourself, because that's usually told to you by the client. So when I was asked to talk about planning for the future, I don't know about you, but sometimes 5 minutes into the future is far enough that all I can handle some days. So I think the main thing today is just be prepared and be aware. Some of the things I mentioned may not pertain to you. You may not have any need for them right now, but at least you can put it in your Mary Poppins bag so that when that day comes, or if that day comes, or a friend or neighbor needs something, you say, oh wait, I think I know about that. I know we're from a lot of different counties. The state of Ohio is broken up into what they call area agencies on aging, and there's 11 of them throughout the state, and they oversee the different counties and provide programming from the Older Americans Act, which was started back in the 60s. And we've been very fortunate to have that renewed every year. So the money comes from the federal government to what they call the AAAs, the Area Agency on Aging. We are under the Western Reserve Area Agency on Aging in Cleveland, and that encompasses Cuyahoga, Geauga, Lake, Lorraine, and Medina. I do have a map for later, and after Dr. Walter speaks, I do have a map for those of you that are not from one of those 5 counties that I can give you which area agency on aging oversees your county. It's very important to get connected with the AAA because they have a lot of programs that they administer. They have a lot of information they can provide to you just to get you started on wherever you're at in life. Okay, so the Area Agency on Aging is a resource for just general information and resources. They are the agency that provides a caregiver support program, which if you toured out there, the different organizations, there was one there, the caregiver support program. They also provide what they call levels of care. So if you're in the hospital and you're going for some physical therapy and things, that's who they contact. But they're also just a great resource of when you don't know who to call and you're on this global level, you're like, where do I start? They're a good place to start. I always say you don't know what you need until you need it, and then where do you go for it? People still don't know that the Office for Older Adults is in Medina County. They don't know because they didn't need it. There's a lot of things that we don't know about because we don't need it, but when we do, we need it now. So I want to give you some information so that when your now comes up, you feel relaxed and calm and can make good decisions, okay? So you have those big AAAs, those area agencies on aging, then that trickles down to local offices. So like I said, for Medina County, the Medina County Office for Older Adults serves the entire county. So we serve people 60 and up for some programs. We serve people 18 and up if they have a disability. And that's been a wonderful thing and a one-stop shop for a lot of people. So what do we offer? First of all, each county, it's great and it's not, but each county chooses to put their monies into different programs. So Medina puts the bulk of their money into transportation and meals. So not only are we the Office for Older Adults, we have the Senior Center. We have an outreach department that goes out into the homes to provide home delivered meals to folks that maybe come home from the hospital and they need a little help while they recover. We sign them up for transportation. We sign them up for meals at the Senior Center. And getting connected to your local offices on aging, huge. because not only is it a great place to socialize and be with people, and I think we learned that from the pandemic, that isolation is awful. It's really awful. And we are human. Our nature is to be with people and be around people. So getting connected with your local Office on Aging is paramount to moving forward. You learn a lot, you share a lot, and you feel supported in whatever you do. So like I said, we have a pamphlet, and I have a few that you can look at later just so you know what we do. We have exercise programs, we have art classes, we have 3 pool tables. So we have a group of guys and gals that come in every day and shoot pool. We have movies, we have entertainment, educational programs, we have support groups. Connecting with that office has been, I wish I could have brought the video had I been thinking, but we made a video, and to listen to the people that participate there, it's changed their life, because they know that they can ask a question right there, and there's people that they can talk to about Medicare. Medicare is our hospital insurance that covers all the medical bills and things that we have for the most part. And a lot of times you have a question about that. That's something our office handles, and a lot of the local area offices for aging do. Open enrollment is coming up. That's something to consider too. Are you happy with the plan that you have? Is it covering the things that you've been to over the past year? Are your medications covered? Do you just want to look at something to see if there is another option for you? That's something those offices can do in person. So you don't have to talk to somebody on the phone. I know there are folks that can come out to the home, and that's great too. We don't charge. Tax dollars have paid for what we do. So it's up to you to decide if we have made your tax dollars worthwhile. There's also benefit programs that you can connect to through them. So getting connected on a local level for heating programs, for information on financial assistance programs for medication. All that can be found right there. So knowing that ahead of time, knowing that you can go somewhere and just ask questions, I think takes a lot of the anxiety and a lot of the confusion out of things as you move forward. We all know that we think we have it all together and we're that beautiful package all tied up, and then all it takes is one little tug on that bow, and there we go, the box is opened up, and now what do we do? So having that information available to begin with, I think will help ease some things. The other thing to look into as well to prepare for things and just see what you might be eligible for is the veterans benefits. We have a lot of benefits for veterans that they don't know about. Some veterans don't want to be connected with the VA for a lot of different reasons, and I always try to talk to them. I started out with the World War II veterans when I started, and we've moved through into Korea, and we're moving in through the Vietnam era, and the Gulf War just came up the other day, and I thought, wow, I've been around a long time. But checking into the VA, and each office or each county in the state of Ohio has a Veterans Services Office. Not the VA, not the one in Cleveland, not the one that administers the programs, but an office where you can go and talk to somebody and they can help you fill out the benefit paper to see if you qualify. There's a lot of things now that the VA has connected and to service time, a lot of conditions, and it's growing, it seems to me almost every day, that make veterans eligible. If you even go for your medication or your vision or dental or hearing, you don't have to give up your primary doctor. You can still stay with a doctor you're comfortable with and that knows you, but it's an extra layer of coverage for you. They also have some wonderful programs that can provide in-home care. There's a point in all our lives where we may need that, and so they can do that as well. But it does take time. So that's why I encourage you just to look into it, just to check and see what is available. Do I qualify? There are also financial programs that can provide assistance in the home. So if you're in the hospital and you had some type of surgery or procedure done, and you get home and you realize, I need a little extra help for a while, you can get some assistance through the VA, okay? But talking to them is where you have to start first. And again, like I said, it's the local one, not the big one. I know people get lost when they call the big one downtown. But there are also local offices throughout. There's, I think off of White Pond, there's one in Brook Park, there's, in Cleveland. So they're starting to crop up in that so that they can administer the care and meet the needs of the veterans. It doesn't hurt to talk to somebody. The next thing I think that all of us in this room, outside this room, and everyone in the whole state and beyond, we need to look at what do we want down the road, right? And that's a difficult conversation to have sometimes, but you want to make sure that your wishes are understood, that your wishes are respected, that people know. So what I'm referring to is meeting with an attorney or someone else that you trust as a paperwork for powers of attorney for health care. I just did mine not too long ago, and I had a lot of people asking me, have you done that? And I'm like, no, I will. Now here I go out all the time, and I ask people, do you have your power of attorney? Do you have this? And so I need to start walking the walk if I was going to talk the talk. So getting the power of attorney for health care, power of attorney for finances, so that someone could make some decisions on your behalf. If you already have those in place, you need to review those every so often, every few years. I have a lot of times that a power of attorney is needed, and when you look at who the people are on there, they're not able to be in that position anymore. They're not around. They're out of the country. So you want to think about that and review that and make sure that that's the person that you want, and that review with them too what your needs are, what your wishes are. Planning for financial issues down the road. I mentioned some in-home care. In-home care, most of the time, is paid for privately, and in-home care has gone up in price over the years. But there's a lot of things that can help with that. The veterans, you can look into calling the Area Agency on Aging. They have programs that can assist you as well it depends on resources and eligibility. There are programs through local offices that can provide some help. So you want to look into that, and how can you sustain that? Is it a long-term care insurance policy? Those were really big several years ago. I haven't heard about them as much, but some people purchase them and then don't remember they have them. Quick story. I had a couple that had an unbelievable, incredible policy. I've never seen one like it. I've never seen one since. And it paid for everything. And even when, if he had to go someplace else for some respite care, they chose not to use it because they didn't need it. I'll just say that they only used it for about 4 weeks. So for 12 or 15 years, he paid for this fabulous policy, but he didn't get to use it that long. So I encourage you to get connected with services early. I had someone tell me that it's not being dependent, it's being interdependent. So it allows you to continue to do what you need to do and want to do. I think some of us, we're very proud, and we can do it and we can manage. And I had a lady come up to me after a talk one time and say, well, that was really nice, but you left something out. And I went through my head and I thought, gosh, what did I leave out? And she said, you forgot to tell people, don't be stubborn. I said, well, I can't tell people that. So I'm not saying that. This lady is telling you that. Look into it. Be open to ideas. And the sooner you do that, the better that is too. The other thing for planning, like I said, is staying connected. Stay connected with people, being connected with neighbors and friends. the senior centers, volunteer things, volunteer opportunities. Those are super important to maintain and continue on. And you learn so much from other people and other resources that you encounter. Another part, this is a little bit off being prepared, but it is being prepared because it's affecting a lot of people down the road to connect with the resources that I mentioned, and that is scams. And I don't know, I'm sure everybody in this room knows someone who has been part of a scam, an attempted scam. You hung up quick so you weren't scammed, but we do have a scam squad in Medina County, and it's run by our assistant prosecutor, because the scams right now are unbelievable. In the time that I just talked about them for the past, 45 seconds, probably 3 new ones have developed. So that's something to be aware for and be prepared for and know who to call. The big one is Publishers Clearinghouse, which is a great organization. It still exists. They do still give the big checks, but they don't ask you to pay $20,000 first to claim your $1 million prize. They don't ask you to buy gift cards to do that, or anyone else, or the IRS doesn't ask you to buy gift cards to pay something that you don't owe. So if you have a call like that, you have someone call, you have someone on the phone that says, oh, this is your granddaughter, this is your grandson, I'm in trouble, and they're very frantic and they're talking, and it's, oh my gosh, I can't believe this, that they're in trouble and they need my help. Hang up the phone, call them, call their parent, call somebody that knows them, because that's a big scam too. And folks are I had one gentleman who lost $250,000 to Publishers Clearinghouse. So all those things, wonderful things I talked about, getting services and that, he's limited in some choices. So be aware, I do have pens that I brought. So even though that says Scam Squad, Medina County, it may remind you if you're on the phone and you see that pen and someone's asking you or telling you that your computer has a bug and a virus, and if you just give them this and they can take your computer and fix it, you'll be like, no, I remember that. I'm not gonna be part of that. Connecting with your doctors, having open communication with the doctors and the nurses as far as preparing for what's next, or what exercise program, what's the newest research, what's the newest thing I can do and see and be part of. Those are very important things. Always be honest, and that's hard. It's very hard. But people can't assist you the best way that they need to if they really don't know what's going on. So I encourage you to do that. Let's see. Those were my main thing. I'm trying to think if I left anything out from those. I don't think so. I think that's the main message that I wanted to convey, to be prepared. Get some financial advice, talk to the attorney for your powers of attorney, connect with your area agency on aging, connect with your local offices, and see what programs are out there for you and what's available for you. And I will be available afterwards if anyone wants to meet with me to see what Office on Aging your county is covered under, and so you can give them a call and they can get information out. I also have resource guides for the 5 counties that we do cover, which like I said, is Cuyahoga, Geauga, Lake, Lorraine, and Medina. Even if you're not from those areas, you can take a book, because there are examples of powers of attorney in there. There's checklists for different things, for home health care agencies, for Medicare. So just in general information. And it also provides you with maybe an organization that you don't know what you need, but when you look in that book and you read the description of what they provide, you're like, that's it. That's what I need. And then you can take it to somebody and say, do we have somebody in our county that does this? Because it may not be the same agency from county to county. So that's the important thing. So please feel free. I really don't want to take them back, and my daughter doesn't want to help me do that either. So since we dumped them in the middle of the street coming over here, I will be available for questions afterwards. So if you have anything that you'd like to ask or something that pops up, I will wait around. And I just thank you for coming to this beautiful event. So many people here, so many good resources, and the schedule and information for you to take away. And if you only take one or two things away from here, that's made a difference, and that can change your life. So be open to all of it. So thank you.
Hello, everybody. How's everybody doing today? I know I see a lot of faces. I know a lot of you, but in case you don't know me, I'm the section head for the movement disorders at Cleveland Clinic. I'm Dr. Benjamin Walter. And today and this event is really about taking control of Parkinson's. And there are certainly challenges that Parkinson's presents at different stages. We're going to talk about hospitalization, and it's a challenge that we have been working very hard on, and there's a lot that we can do, and there's a lot that you can do as well to make this better for you and for others. And it actually applies to everybody with Parkinson's, either early or late, because anybody can be hospitalized at any time, and usually not for Parkinson's disease. And one of the goals that we really wanted to do when we started thinking about this is to make Cleveland Clinic the safest hospital to get care in for people with Parkinson's. And this is because we recognize that this is a big challenge. It's a challenge because people with Parkinson's are sensitive when they're sick, and the medications that you use are complicated. They're complicated for you, and they're also complicated for doctors that may not be as familiar with your medications as you are, because they're not Parkinson's doctors. They're orthopedic surgeons, general surgeons, internists, infectious disease, and other areas of expertise, depending on why you're in the hospital. And the Cleveland Clinic, our main campus, is a very big hospital, and we have to think about this in the sense that we have lots of patients coming through for surgeries. For DBS, we do over 240 a year. It's a very large hospital with 1,300 beds, and soon to get a new neurological hospital in the next 2 years that will have the largest neurological hospital in the country with inpatient beds, if you can believe that. But we also have 18 hospitals worldwide, and 11 of those are in Northeast Ohio. So we're trying to make care better in the sites that we can affect, but also really across the nation and across the world that we touch. And when we started looking at inpatient care, we started publishing some articles on this and starting to look at the data, and there's a lot to learn, and there's a lot of problems. In census, we've actually published about a dozen articles, and we have more coming on the work that we've been doing, so we can share this work with others so they can do the same. This is the problem. The problem is that patients with Parkinson's are at high risk for complications when they're hospitalized, and one of the challenges is that we have a lot of knowledge in our expertise, certainly with handling people with Parkinson's disease, and we're in the clinic where our patients come to see us, where you guys see us every month or every 6 months or so. But in the hospital, there's a different set of specialists, and that's not usually where people with Parkinson's get their care, and those specialists have different backgrounds. So what we realize is we need to find ways to bring these two together so that we can provide specialized inpatient care for people with Parkinson's. So some of that knowledge is transferred so that we're not spending all of our time making you well in the clinic, and you end up over there in the hospital, and it all gets unraveled because you're not getting your meds the way you're supposed to and the way we've prescribed. And the challenge is big, and in part because every year 1 in 4 people with Parkinson's get admitted to the hospital. And this actually goes up every year that you've had Parkinson's, and it's not for Parkinson's disease. Only 15% of hospitalizations are related, this is because people have elective surgeries, because they have other health problems, and sometimes other related issues. But the most common reasons for hospitalization in somebody with Parkinson's is a fall with fracture, pneumonia, confusion or encephalopathy, dementia, and hypotension, where your blood pressure is low, and these are a little bit more related. This is an example medication regimen. It might look like yours. It might be a little more complex or even more simple depending on where you sit in this audience. But as you can see here, we've got times across the top. This patient's taking meds 5 times a day. They've got 2 different formulations of carbidopa, levodopa, or Sinemet, the immediate release, the controlled release. There's an entacapone, which makes it last longer. There's rasagiline, which once a day, which also makes it last longer. This is confusing to doctors because there are specific schedules in the hospital. If you take things 4 times a day, they're going to assume it's spread out evenly, what they call QID, which is every 6 hours. This is every 4 hours, which is more typical for a slightly more advanced patient. Some of these meds need to be given together. The entacapone and the Sinemet need to be given at the same time. So there's different constraints for different medications, and they won't necessarily know that. There's also a lot of different types of levodopa. We've got many formulations of Sinemet or Rytary. You may have heard of Crexont. That's a very new one that's coming out in about 2 weeks. There's Stalevo. These are all different formulations, and they work differently. And even if the milligrams look the same, they're not. And it's very easy to mix them up because they have 2 different drugs in them. There's carbidopa and levodopa. The levodopa is the more important one. But controlled release is different. It's not quite as strong for the same milligrams. Even Rytary, the milligrams aren't the same. You wouldn't take somebody on 100 milligrams in their Rytary form and give them 100 milligrams in Sinemet. It's different. And you don't need to know the specifics of it to know that you shouldn't substitute. You need to be taking what you normally take and the times that you normally take it. And the doctors may say, well, we don't have that one. We're going to give you this one instead. It's probably not going to be right. It's certainly not going to be precise. And so those kinds of substitutions should be taken with great scrutiny. If you look at the national data, this is why this is such big of a problem. About 20% of all medication events for people with Parkinson's are wrong in the hospital, 1 in 5. And 90% of all people who are admitted get their medications wrong. Not right, but wrong. This was an early study that came out in 2012, and hopefully we've learned some from here. But it's more often wrong than right, particularly when you look at a whole hospitalization, because there's lots of opportunities to mess things up. And unfortunately, it happens. And I don't want you to be scared. I want you to be empowered to understand where this comes from, what we're doing to make it better, but also what you can do to take some control of this as well. Half of these are missing doses, so people just didn't get their meds when they were supposed to. But 20% of patients got contraindicated medications that make Parkinson's worse. And the timing of the medications, as I know my patients and a lot of our patients know, is critical, particularly as you become more advanced. The medications last for so long. And if your meds wear off early, we want you to get your meds on time so you're not sitting around waiting for your meds to work, and your meds aren't working because your nurse hasn't brought it for you yet, and you normally take it at noon, but they're going to give it to you at 4 o'clock instead. That's just not acceptable. It needs to be on time within about 15 minutes, certainly not more than 30 minutes of when it's due. And I know a lot of you may say, well, we told them that, and they said, well, we have an hour plus or minus to give it on time. That's not true. Not with Parkinson's disease. It's a time-dependent medication. It needs to be given on time. And the more advanced you are, the more important that is. So we always say 15 minutes, 30 minutes max, it needs to be on time. What they end up doing if they, give it late, or if they accept that, sometimes it'll get so close to the next dose, and the question is, do I take 2 instead of 1? And that's horribly wrong too, because you get side effects from taking too much as well. Contraindicated medications are meds that worsen Parkinson's disease. Generally, these medications block dopamine function, and dopamine is what you're missing in Parkinson's. And the thing to remember about this, and it is worth actually knowing what a couple of these medications are, and you don't have to write it down because this booklet here on the right just came out from the Parkinson's Foundation, and we have, I think, one pretty much for everybody here over on the table outside the rotunda. So make sure you stop by there and get one. They're also available through the Parkinson's Foundation from their website, which is parkinsons.org. But this booklet has information for you and information for you to share with your doctors on what is right and what is wrong in taking care of people with Parkinson's. So if you don't end up at one of our hospitals where we're able to guide things, you can also advocate for yourself. And everybody needs to be able to do this, because even if you have the best hospitals in your backyard, and hopefully I think you do, you're not always going to get sick or be in the hospital when you're here. You could be in Arizona, you could be in California, you might be traveling. And so it's important to know how to advocate for yourself or for your loved one. And this booklet has everything you need to do that. So the meds that you should not get are antipsychotics, except for a few, and there's only one that's actually FDA approved, and that's Nuplazid or pimavanserin. But we often use quetiapine or Seroquel as well, which can be used safely in people with Parkinson's, and the community accepts that. Clozapine is another one that is safe in Parkinson's, but is rarely used because it's very difficult because you need your blood checked every 2 weeks or so. So realistically, it's quetiapine or Seroquel and the pimavanserin or Nuplazid. Nausea medications, what we call antiemetics, a lot of them block dopamine as well. Phenergan, Compazine, and Reglan. So those are also called promethazine, chlorpromazine, and metoclopramide.